think it's important. And I think it's important also to go back to, you know, since the state is always spending money on all these studies and things that we all know exist. I mean, so what is the trend been like since we've been spending money? Even since 2005. Now, you mentioned the study when you talked to Representative Word, the period of time, 2000 to 2009, where you see a decrease, and that was the gap that you, or that parameter of time that you looked at to see the decrease in sudden infant death. But, I mean, why can't we have more of that? We've always talked about obesity, ever since I've been in the legislature. BMI was a big to-do. Access to health care was a big to-do. Why not tell us what we have done in terms of alleviating these kinds of issues? So I think that would be helpful to show maybe we've done a good job in financial resourcing of things, of policies that we put in place. Will you consider that in your next report, or at least going forward, on how to solve these problems?
Certainly. Maybe we can get together to get into some of the specifics of what you'd like to see in a report of that sort that we've not included.
Okay, and then last reference, you talked about the vision or the dental care that's lacking and non-existent in some parts of the state, particularly in the rural parts and in minority communities, particularly in the southern part of the state, in the Delta. And so, and it goes back, Mr. Chair, to, I just can't get over this Centene thing when I really got into it yesterday. Did you have any, was there a link between the Department of Health and DHS and the Insurance Commission in determining these insurance policies and how coverage would be extended and what would be in the policy to address these health problems?
Members of the health department staff have been part of some of those conversations, but those coverage decisions have not been it's not been our department, the Department of Health, that's been driving those decisions, but our staff have been included in many of those conversations and discussions.
So you wouldn't have made the recommendation that coverage be extended equally to all the people in the state of Arkansas, even in those pockets where people don't have access to that kind of care or treatment because of their financial resources?
Without the details of those decisions, it would be difficult for me to comment specifically. But in general, our desire as a Department of Health is to make health opportunities accessible to all Arkansans.
Thank you.